glad that you're with us today and that you're taking time out of what is undoubtedly a very busy schedule to be here joining us for this 1-hour webinar. By way of introduction, my name is Tom Jewell, and I am a senior consultant at CCSI's Center for Collaboration in Community Health. And I also work with the University of Rochester Medical Center's Family Institute, where I'm the Director of Research and Evaluation. Also, by way of background, clinically, I've had the opportunity since about the mid-90s to work in clinically as well as non-clinically with families and people with mental illness. And so today's topic is family engagement to improve treatment and recovery outcomes. And really my job, as I understand it, is to try to help put into context managed care changes and how enhancing family engagement practices can help. So with that being said, this webinar is brought to you by the Managed Care Technical Assistance Center. You may already know what the Managed Care Tech is. For those of you who may not, it's really we're a training, consultation, and resource center that offers resources and training to all mental health and substance use providers in the state. And really our goal and the goal of this utilization management series, which is what this webinar is one part of, is really, it's all about helping to get everyone prepared for transitions to a Medicaid managed care. So who makes up Managed Care TAC? It's part of the McSilver Institute for Poverty Policy and Research at NYU, and it's also partnered with CASA at Columbia, which is the Center for Addictions and Substance Abuse at Columbia University, which is really dedicated to improving prevention and treatment outcome in addictions. There's a number of partners with Managed Care TAC. There's Coordinated Care Services, which is where I'm, that's the hat I'm wearing today. We partners with ICL, IDEAS, NIAPRIS. So there's really kind of a collective group of partners that really make up the Managed Care Technical Assistance organization. And really this webinar series is the final in the series of utilization management webinars. We did want to note that there will not be an applied learning discussion on January 19th. So this is really the final event of the UM series. And I did want to let you know that the Managed Care TAC will be emailing a very brief follow-up evaluation about the entire series, in addition to some polling questions that we're going to pull up momentarily. And we'll ask you to, please consider completing the evaluations, really so that we know how to improve the series in the future. We want to keep making these events better and better over time, and make sure they address the needs and wants that you and your colleagues have. So please consider giving us some feedback about that. So the objectives for this webinar, and this again is a family engagement. The first objective is really to talk about engaging families in the context of managed care. And although we don't have it anywhere in the introductory slides, largely what we're talking about today is family engagement in the adult behavioral health system. But certainly we think that there are things to be gleaned also if you work in a child serving system. So we'll talk about that. Second, we're going to talk about really to help people get an understanding of common experiences of families and people with mental illness, really to help provide the foundation, if you will, and background for being able to do engagement work well. Then we'll talk about engaging people, consumers, clients, regarding their interest in family involvement. That's really where family engagement and involvement really starts, is with the person with whom all of us are working. And then we'll also talk about engaging family members and a bit about how to do that and some strategies that can be helpful. And again, the lens for all of this work and the context really is the new managed care environment. So we thought we'd start with the kind of the most basic of questions, which is if you're in a clinic, whatever your setting is, a program, a facility, why consider family intervention? And you know, one reason dates back actually over 10 years now, and you know, family issues have been on the radar for quite a while now. And actually, let me pause for a moment. Before doing that, after objectives, I meant to ask to have a poll pulled up. Really, we have a few questions that we'd like to invite you to answer to help give us a sense of what you already know about this topic and the learning objectives. If you could please take a moment to complete the questions. You should see them on really the right side of your screen. Okay. Again, this is helpful to just give us a sense of what people already know about this topic. And we'll keep moving along while you're answering those items. So again, the issue of why consider family interventions, it really was a recommendation of the President's New Freedom Commission a little over 10 years ago that mental health care really is and should be consumer and family driven. So again, not just consumer driven, not just family driven, but both. And this really aligns well with the work happening now in New York State, where really our big picture goals statewide that you're likely aware of include developing a person and family-oriented system. So what we wanted to suggest is that it's important for a program, a facility, an agency to consider aligning with that goal, and then, of course, to document the work you're doing and document that it's happening and that you're doing that alignment. Take-home message from today's webinar is going to be this. So if you walk away with nothing else, this slide we think is significant, and that is that families and significant others are important and can be helpful members of the team. So it's a way to really broaden the team as you're working with individuals on a number of issues. And with proper documentation, involving families can be a strategy to help us provide really optimal care that's needed and cost-effective. So that's really using the kind of utilization management language there. Optimal care, it's needed, it's cost-effective. And so we really hope that by the end of this meeting you walk away with that as a take-home message. So what is utilization management? This is a slide we've been using for all of these webinars. Just really quickly, UM is a process by which a managed care organization really decides whether specific healthcare kind of services are appropriate for coverage under someone's plan. The purpose is to ensure that services are necessary, appropriate, and cost-effective. So certainly as we're thinking about family involvement, we'll need to really think through that issue, and also to meet UM standards and requirements while maintaining fidelity of service. It's required for reimbursement, and again, it's intended to be consistent with optimal care for clients and consumers. So there's a lot more information about UM on the managed care tax website, which you can see at the bottom here. We'd encourage you to check it out. And by way of a motivating factor, again, if you have the sense of, okay, well, why consider family services? Why might our agency, program, institution, really look to this? This is a slide that I borrowed from a different webinar from the series, the client education webinar. And it's about home and community-based services. I'm not going to go through this whole slide because you've seen it before. If you look at the bottom, you can get a lot more information. And really the idea is that HCBS services are designed, if you look at this middle kind of bullet here, to help people achieve recovery and stay out of hospitals or other institutions. The focus is on 4 basic areas: employment, peer support, family support, and coping and everyday living skills. So when it comes to HCBS services, that if you don't know about them, you'll be hearing a lot more about them very soon. Family support is really one of the 4 key areas here that again, to pay attention to. If you look at the manuals and updates regarding HCBS, there's a family support section that really outlines and highlights several different types of family support services, and we'll kind of cover some of those here under options. So there's a lot of work that your agency and program can be doing. Also, family engagement is just connected to everything else. So client education, tracking and treatment plan adherence, supervision, kind of all of these topics that we've talked about over the last few months in this utilization management series really can relate to family services. So family engagement can be included in assessment and clinical formulation for treatment planning and treatment, and it needs to be documented. And so these things really all tie together, and supervisors can really support this work by helping practitioners understand how this work really can support what they're doing with people, both clinically as well as in the organization fiscally in the new managed care context. So that was a bit of background there. We want to keep things moving by talking a little bit about defining family. So how do we define family? There's actually a lot of different ways to define family. Family certainly can be blood relatives, but also can be much more loosely defined. Non-blood relatives, immediate family, extended family, blended families, significant others, close friends, clergy. So throughout this presentation, as I'm using the term family, it really relates to all of these different assortments, if you will. And what's really most important for the purposes of our conversation today is that the consumer, the person, defines who is in his or her family and support network. So from the perspective, we suggest, this choice is up to them. This is individualized care, and the recommendation is to be sure you're documenting that you've done engagement with the consumer, that the consumer's made choices, and how family involvement can really inform and support individualized recovery goals. It is worth noting that you've probably seen the statistics. About 1 in 4 people in the United States are diagnosed with a major mental illness. That translates into lots of family members. Talk a little bit about common experiences of family members. And again, it's very basically this presentation and slides will be available to you after this meeting. Within the next couple of days, we typically get them loaded into the managed care tax website. So there's a lot of content here, but that's available for you. You can check in on that at a later time as well. Really some common experiences of families that family members experience, but what's called in the field subjective burden. And that's things like there's a tremendous amount of worry, anxiety, confusion, sadness, frustration that really comes hand in hand with the experience of, in many cases, watching their relative experience a major mental illness. Family members also experience what's called in the field objective burdens. Expenditures of time and resources and just their day-to-day activities are impacted, and that change in family role. So this is really kind of, if you will, the trickle-down experience of a psychiatric condition on family members, friends, and people around the individual, There's also a wide range of other experiences that you can see there, including things like personal growth and how unsure how to be helpful. There's a number of things. It's important to note that consumers and professionals also have a range of experiences when it comes to family involvement. So this isn't just about the family experiences. Consumers and practitioners have a number of things that they experience. So perhaps if you're watching this in either of these roles, you may be able to relate to some of these. It may be that there's consumers that want their families involved, but only in really specific ways. Consumers can be angry and frustrated with families and don't want their involvement. Or maybe there are no family members available, no family members, friends that people can point to. You can look down the list. There's a number of experiences that consumers and practitioners experience. Burn bridges, or the consumer and practitioner may decide, okay, we're going to reach out to family, but families say no to involvement if asked, or families don't know how to be involved in helpful ways. So there's kind of a number of experiences. Maybe you have experienced some of these as well. Unfortunately, what all of this can often do is lead to just a bunch of missed opportunities when families are not engaged. One of the missed opportunities is really broadening the network, or really the team of people who can work together to assist the person, to assist people kind of on your caseloads and the people with whom you're working and care about. Another missed opportunity is it's really clear, and research really has demonstrated over and over for quite a while now, that things like relapse and readmission prevention, so rehospitalization, symptom spikes, preventing that is typically most effective when early warning signs of relapse are identified and monitored. Families and significant others can be part of the team when it comes to monitoring warning signs, not in a coercive way or behind individuals' backs, but really as full partners and with the person's full consent and approval when kind of done in certain ways. So that's a missed opportunity, extending the team in that way. Increase revenue by increasing show rates in outpatient settings, and when people are transitioning from more restrictive settings into outpatient settings, again, it's clear in the field and anecdotally that family members often are helping people get to appointments or doing reminders or supporting people in certain ways. So by partnering with some people who are out there in the field, so to speak, in the natural settings where the people we serve may be, this can be a way to again help with engagement into the services that you are offering and providing to people. And another missed opportunity is there's some evidence now that there can really be improved consumer views about and satisfaction with treatment and relationships with practitioners when practitioners start involving family and really kind of broadening the net, and as they're looking at someone not just as the individual, but also as an individual that's kind of part of a family and that has maybe some natural supports out there. And so those are some of the missed opportunities when families are not engaged. There was a white paper by National Alliance on Mental Illness in New York State that came out, well, I guess it'd be 10 years ago now that we're in the new year, that really talks about important roles for families. And I wanted to show this slide because although families have historically been excluded from the mental health system, there's really a recognition, especially in recent years, that there's many important roles that family members can play in recovery. So you can look at the list. Families can provide things like crisis intervention help, so help during crises, help with kind of case management and paperwork and things like that, help with counseling and being supportive, basic needs. There's a number of things there, advocacy, love, companionship, offering kind of ongoing, enduring relationships. So there's the many possible important roles for families. The reason we have the dollar signs there on the right is this part's more commentary on my part, which is in all the years that I've been doing this work, I've never had a family member ask for a paycheck. I've never asked them to ask for some funding to serve in these kinds of ways, ask for anything fiscally to help with crisis intervention. Families can, really are typically there and can be there to serve in these roles without that. So again, from a utilization management, managed care, how are we as an organization going to do more with less? Really extending the team and figuring out a way to partner with families can be very fiscally responsible as well. And I think a takeaway is that in order to do these, not all families are capable out of the gates of doing these things. They typically don't have graduate educations in the behavioral health field. So families often need, understandably so, some combination of education, support, and practical skills to be most effective in supporting recovery. And really that's where if there's practitioners on the line here, that's where you as practitioners kind of come into the picture, so to speak. So let's talk about family work as best practice. So as best practice, this is some treatment recommendations from a very well-known team, schizophrenia patient outcomes research team, which has had a number of updates over the years. And really the idea is that family work is best practice, that people with mental health concerns who have ongoing contact with their families or wish to should be offered a family-based intervention which provides a combination of, and then you can see the 5 things listed there, education about the illness, family support, assistance with crisis intervention, some problem-solving skills training, and practical guidance. So these are the types of things that families on a routine basis, where the field kind of aligned with the literature and the evidence-based practices around family work, this is the kinds of things that would be offered on a routine basis. And so again, the recommendation and encouragement here today is to consider offering this combination as an option to the consumers, to the clients, the participants with whom you're working, as a way that their family could be brought in. And this bottom one of practical guidance is really a big issue. People often are kind of like lost or looking for ideas and don't know where to turn, and of course, why would they? As something happens to their loved one. So practitioners, mental health professionals are really in a great position to provide these types of services and resources for families. This is just a slide if you're considering this work or you're currently doing some of it and you want to really kind of say, hey, how well does what we're doing align with the characteristics in the research about effective family psychoeducation programs. So you can see here there's a number of them, and it's things like showing concern and empathy, providing information. Information really is key. Avoiding blaming. There's certainly some kind of old school thinking that family members are to blame for the onset of severe mental illness. Fortunately, we know today that there is not evidence for that in the research literature, and that really did more of a disservice over time in many ways. So really specifically, this is one thing that's listed in any materials you'll see on family psychoeducation is take a non-blaming approach, promote adherence to medications, be flexible. Then you can see the whole right side, and still hope, provide a long-term perspective. So there's kind of a number of things that really can be a core part of the work you're doing. And again, I would argue and suggest that this slide and taking this stance really will map nicely onto the HCBS services if your program really decides to pursue these for those people in a HARP. And if I'm using language that doesn't make sense, again, please go to the managed care website, and there's a lot more information about these HCBS services, but really providing those services with this as the backdrop and kind of documenting those services every step of the way is something that's important and for you to consider. So let's talk for a minute about the benefits of family involvement. There's actually, at this point, ever since the late 70s, early 80s, there's been study after study talking about the benefits. We just have a couple slides here. We didn't want to kind of have this be a huge data presentation per se, but some benefits of family intervention that's been shown to have many positive effects, such as reducing relapse rates in schizophrenia over time by 20 to 50%, helping people have fewer and less severe symptoms and much greater stability. Family intervention has been shown to improve adherence with medication, as well as, and you can see some of these on the bottom are related to families themselves, improving family member knowledge, functioning, and coping, reducing distress, and helping people have greater hope and being empowered and greater satisfaction, life satisfaction for their family members. So there's kind of a number of benefits of family involvement. This table gets at a little bit more of the literature and kind of really the hardcore science of family involvement. This is, I think, the only slide that we have in this presentation that gets at it. And what this one is to help you understand what it's getting at is it's a meta-analysis that they looked at 11 randomized controlled clinical trials. So these are well-designed studies where people really are randomly assigned into different conditions by like the flip of a coin or computer program or something to randomly assign people every other referral to a program, things like that. And it really gets at what can happen when families are involved in specific ways, so that whether doing the best practice family work that we just talked about a few slides ago. So if you look at the slide, the way to read this is the N of 895 across these 11 studies. There were almost 900 people enrolled in these studies. The mean length of treatment was just over a year and a half, 19.7 months. And the way these studies tended to be designed, of course, each study was a bit different, but the way they tended to be designed is that half of the people in each study were assigned to something called treatment as usual, which is that TAU at the bottom there that you see along the x-axis, the treatment as usual condition. And that's probably what, really what any of us would probably expect if we were to walk into any typical clinic. It's typically a combination of being assigned a therapist, psychopharmacology through a psychiatrist or nurse practitioner, that type of thing, perhaps some case management, some groups, things like that, treatment as usual. The other two conditions, the SF is single family, the MF is multiple family, and so those are the two different family psychoeducation conditions. I'm happy to, if anyone wants to reach out to me after this, if this is something that you're interested in, I'm certainly happy to send you a lot more information about this, and we'll have an email at the end that you can send questions to. And so essentially what these studies have found, again, really since the early 80s and on, is that when people are assigned, half are assigned to treatment as usual, half are assigned to a family condition. You look at relapse rates over the course of about a year and a half, a little bit longer. In the treatment as usual condition with schizophrenia, just over 60% will have had a relapse. In the family conditions, you can see that is under 30% have relapsed over those times with the addition of a family intervention, because that's essentially what that is people are assigned to treatment as usual plus the family intervention condition. So again, this really, when the findings started occurring and studies started looking at this, people really took note of this. This raised a lot of eyebrows, as you can imagine, and it's something that the field, this is one of the more consistent findings over time, is that when this work is happening, these are kind of the results that you get. And we think this is particularly relevant with what's happening right now in the transitions to Medicaid managed care, where at least one area of focus is, certainly providing individualized treatment and person-centered treatment, and also, helping people move toward recovery and stay out of the hospital and work toward less acute settings. So we think that these findings really speak to that pretty directly. So that said, there are challenges, of course, with implementing family-oriented services. If the phone lines were open now, we probably would be able to have kind of a conversation about all of this, and you'd probably be able to, really speak to some of the challenges. And in a way, one way to summarize it is, the problem is that there's overwhelming evidence that family participation in the mental health care, behavioral health care of individuals with mental illness contributes to improved consumer and family outcomes. That's clear. That's beyond kind of any shadow of a doubt at this point. However, family involvement typically does not occur in routine settings. So, the question is why, and this is something that, a lot of people in the field, nationwide and worldwide, have really been pondering and trying to understand. And at the Family Institute, although I may be kind of one voice talking from the Family Institute now, there's a whole team of people working on these issues. And some answers to why are that we think that consumer and family preferences are often left out of the process. Often there's kind of this one family intervention, a single form that's offered as a way to involve families, and it's kind of here, kind of take it or leave it. This is the way we work with families. So people's preferences are left out. Also, engaging consumers about this issue is not always easy for practitioners, and people want and need things at different times. So again, there isn't kind of this one cookie-cutter family service that's going to address everyone's wants and needs. It's a big problem in the field. And so what to do about that? And if you're listening now and you're thinking, okay, you see the research evidence, this is a problem in the field. What can be done about it? And something that aligns really well, again, with the transition to Medicaid managed care and individualized service planning and assessment and goal setting and really thinking things through is when it comes to family involvement, it's extremely important, as with the other work you're doing, to give people choices. And there are many choices for involving families and supports in a lot of different ways. And again, people are going to want and need things at different times. And you can see some of them listed here. And there are things like giving people written information. That may be a choice that someone wants, that, hey, I don't want or need family therapy. That's not something I'm interested in, but I'm okay with you giving written information to my mom, to my sister, to my uncle, to my friend, things like that. Formal family psychoeducation, calling a treatment team as needed, offering family information nights, and again, many of these things really tie in with the HCBS services that are currently being discussed and that are in the manual and the updates about HCBS. The right side, attending treatment sessions, attending a support group, family consultation meetings, linking with the National Alliance on Mental Illness. So I think that the takeaway from this slide is there's a lot of different choices. No single one of these, no single form of intervention is kind of sufficient to treat just the diversity that's out there, kind of like the no one size shoe fits all. And so the thinking is that things really go best when these different options are matched to meet people's wants and needs. And in this case, by people's, we certainly mean the consumer, the participant, the person who's enrolled in services, as well as when it gets to that point, the family members as well. As you look through this list, I think one of the challenges that I've personally experienced as a challenge over the years, and that we know just from working with a number of programs throughout the state that is challenging is, okay, say a program, a site, a clinic kind of buys into this and says, okay, we want to do that. How do you go about first developing all these services, and then how do you go about figuring out how to match people to meet these? It sounds simple, but sometimes it's not quite as simple to do. So what we wanted to suggest is that something that we've given a lot of thought about at the Family Institute in partnership with the New York State Office of Mental Health, and almost 10 years old is an approach that we wanted to suggest. We didn't want to make this this webinar kind of a commercial for this approach per se, but we just did want to let you know about that doing a specific form of family consultation, consumer-centered family consultation, can be one way to help figure out what to do with people. There's others as well. There's actually a lot of people in the field that are doing a number of things. And what Consumer-Centered Family Consultation, CCFC, is it's a brief, education-based engagement and consultation service. So really the focus is on, in this day and age that I think is important, is this is a brief way to connect with people, just 1 to 5 meetings. It's designed to promote collaboration between adult consumers of services, members of their family or social network, and service providers. There's specific shared decision-making tools that are embedded in the process of engaging people and their natural supports. And it really involves people's natural supports in meaningful ways and helps people make these choices about family involvement options. So what it can do is it can help give you a framework for how do I, as a practitioner or as a supervisor supervising people, how do I encourage people to have these conversations, both with individuals on caseloads as well as when families are in the room with them as well. You know, how do you proceed? What do you do? What's the beginning, middle, and end of that look like? And of course, as you probably know, it all begins with engagement with consumers. And so for this slide, this is more of a general slide. This isn't just the CCFC approach. This is just in general in the field. It all starts with engaging with consumers, and the recommendation is use a person-centered approach to engage people, give them choices, use shared decision-making strategies, and really avoid trying to coerce. This family involvement is not about trying to coerce and convince a person that they need to have their family involved. That would be really counterproductive to try to do that. Instead, it's really about letting them know about choices and letting them know they can involve people from their social network and really having a conversation about that. So the emphasis is on starting a conversation about whether, when, and how to involve or not to involve, and not just family, just globally, just which specific family members or significant others may you wish to involve, how do you want them involved. Let's have that conversation. Let's figure that out before we even do any kind of outreach with the family. Let's really figure that out so that it really, again, for the purposes of our utilization management conversation today, so that it really aligns and is part of the conversation during assessment, is part of what we can talk about during goal setting if the consumer wishes, in treatment planning. It can be a strategy in treatment planning, as well as treatment delivery, actually doing the work. And of course, as we've talked about and as you're aware, documentation of all of that is so critically important. Without documentation, if it isn't written down, it didn't happen, so to speak. So that becomes really important as well. This slide just speaks to the idea that there is a group, Amy Topolsky, Lisa Dixon, a number of people that have really taken a close look at consumer preferences for family involvement in care. So this was a few years ago, a study with 230 adults, and what you can see is, well, the bars indicate which proportion agreed with or disagreed with or had mixed, thoughts or refused, letting the family be provided written information, having the family attend a support group, having the family join into treatment sessions, giving the family the option of calling the team. So the reason that we wanted to show this slide is the idea that you can see that the diversity there. None of these is 100%. But also none of these is 0%. There's a mix here, and so part of the work in this new era of kind of managed care and individualized care is helping people think through what makes sense and you know, what would their preferences be. There are some tools to engage with consumers. I'm just going to go really briefly through a couple because, of course, this isn't a training session per se, but just to let you know really that there actually are some tools to engage with consumers. There's tools, there's visual aids that can be really helpful for practitioners in having these conversations even prior to any kind of family outreach or engagement. These are not all the Family Institute tools, by the way. I just want to make note of that. There's also other team members and other teams, Dr. Lisa Dixon and her team also are involved with a few of these, like these top 2 examples. So there's something called the decisional balance exercise, which is really, again, designed to have people really think through decisions around it involving their family member. There's a values clarification exercise, which is all about helping people identify their general values. You know, what's important to people? Is it getting a job? Is it having a boyfriend or girlfriend? Is it having more money in their pocket? Is it being able to manage their own symptoms, you know, on their own? And, you know, a number of things to clarify what their biggest priorities and values are, and then there's a piece of this exercise that really encourages people to think through how might family involvement, how might involving some natural supports be a part of that. There's also a decision guide and pre-planning tool, which I will talk about a little bit more. So this one it's a decision guide for involving family or friends, and what the guide is all about, it's all about helping adults with mental health concerns and their practitioners, and it's a tool for helping practitioners have these conversations with people and for people to really make informed decisions. So this is, we do use this with people at the Family Institute. It's actually a front and back, you share it with programs. It's laminated, and it's really a tool that it's kind of a guide to help guide the conversation. And it covers things like what are people's concerns about involving families. So it really encourages people to talk about what's on their mind as they're thinking through family involvement. The flip side of that is it also talks about really thinking through as practitioner and consumer, thinking through together what are the pros and cons of family involvement. There's not just pros, there are some cons. People have concerns about losing privacy and things like that. So there's, it really is a way to help people have these conversations. All of these, by the way, if you're interested in receiving them, send us a note. We'd be happy to get them out to you. These are also available on the Family Institute website, which again we can share with you what that is as well. All available for download at no charge if you're interested in taking a look at some of these tools. There's another quick tool called the pre-planning tool. Really important one related to prior to family outreach. If the client, the consumer, has consented to family involvement, like what do you do then? So there's, again, just a two-page front and back, kind of, you can laminate it, a pre-planning tool, which is used to help guide some conversations between the consumer and practitioner to do some planning for how's the outreach going to go, what are you going to do, and again, all of this really aligns well with goal setting and treatment planning and kind of the golden thread that we talk about when it comes to documentation and writing progress notes and kind of writing all of these things in, which is important. The emphasis of the tool is that the consumer is in the driver's seat and has choices. There's a plan that's laid out where the goals and issues to discuss and what not to discuss. So it really kind of fleshes all of that out. It also plans the outreach method to families and supports. In some cases, the consumer may want to reach out to them themselves. In some cases, a consumer may want a practitioner to do the outreach to family and maybe make a phone call or something like that. In some cases, they may want to do it together and say, hey, maybe from your office we can call the family together. So it really walks people through some of the steps in planning that. It prepares the person, the consumer, for this meeting. And there's also some conversation and some decisions that are made between consumer and practitioner about how to handle what we call the curveballs or the what-ifs, or what happens if everyone gets in the room together and X, Y, or Z happens. An argument breaks out or something comes up that you specifically don't want to have as part of your goals for this meeting. And so there's some guidance around how to handle that. And again, this is all in the spirit of eventually bringing in families and doing family work to benefit the consumer. Looking at the clock, we've got just under 15 minutes left. I'm going to keep things rolling here. This is probably much more small than you can see on your screen, but this is just the pre-planning tool. You can see there's a kind of a whole pre-planning outreach section, planning wants, needs, and goals. This bottom section, whole section is about pre-planning for the what-ifs. There's a lot of open space, so it's designed to really be done very interactively with the people on your caseload and the people with whom you may be having some of these conversations with. So we've spent a lot of time talking about consumer engagement, and again, because that's really the foundation of this work and even the foundation to set up good family engagement. Talk a little bit about engaging families now, and really the suggestions that we wanted to share are the idea that families are best engaged with a flexible, transparent approach. So whatever your outreach is, you're flexible. You're not just trying to say, this is a model, please get involved with it, we want you to do this for sure, and please commit 6 months or anything like that. It's transparent, you want to connect with them, you talk with their loved ones, things like that. We do want to say that practitioners should be prepared, especially if this is your first contact with the family member, be prepared to spend some time hearing the family's story. Families have a perspective. Families have an experience of what's happening. So they typically want to talk for a few minutes about that. And families be prepared for the fact that families sometimes have mixed feelings about involvement for really good reasons. So be prepared for some ambivalence. Families also should be educated about the options for involvement. It's not all or nothing. It's not you've got to come into the clinic on a regular basis for this X, Y, and Z. There's a number of options that they have, and we went through some of the options as well. And lastly, hope is important. So people can and do recover. Families can play a meaningful role. So it's important to keep that in mind when engaging with people and to really convey this attitude and convey this belief to families as you are doing outreach with them. A few other tips on a real practical level, and again, we weren't sure about the exact mix of the audience today, so we just have kind of 2 slides that get us some real practical tips for family outreach. And one of them is to just set aside enough time to discuss families' possible involvement and to kind of give choices and have an initial conversation with them. And what I mean by this is we often tell practitioners trying to call a family and do that first outreach contact, if it's 5 minutes or so before you need to go run a group at the clinic, is not a good idea. And that first meeting, you want to try to do something that will give the families a different experience maybe than they've ever had in the mental health system before, which is you might have 10, 15 minutes to connect with them, to say hello, to talk with them, et cetera. Introduce yourself with a role, focus on your role in helping the consumer. This middle recommendation, the third one down, comes right from the evidence-based practice gold standard literature, which is share some personal aspect of yourself to foster some genuine relationship building. This is a real win type situation when you can do this. That doesn't mean full self-disclosure. It doesn't mean kind of change your whole way of that you've been trained and that you practice with people. This really gets at it can be anything, an interest, a hobby, something that holidays are around the corner, anything at all. We could certainly talk more about that again at a later date if people are interested. Explain that it's proactive outreach. It's not crisis-oriented. Make sure to tell them you're not inviting them to family therapy. Explain the goals to them. So are you inviting them to a treatment meeting? Are you inviting them to consultation? A number of things that you can do. Explain that families don't really know what's kind of happening all the time in the field, in the behavioral health services field. So you can explain that, you know, your work is really person-driven, and that their relative or their friend or whoever, whatever the role relationship is, has given permission for everyone to talk with one another, and they are aware that you're talking. So right off the bat, to let people know that. Ask them if they're interested in participating and getting involved with the treatment team in a few possible ways. Let them know, hey, it can be time limited. There's not a lot of kind of pressure here. If they're interested, set up a time to work out logistics and get together, perhaps for a consultation meeting. If they're not interested, you know, ask if you can call them again, give them your phone number, and of course, thank them for their time and consideration. So these are the kind of some of the types of practices that you can do when reaching out to families. So much of this, this is just kind of a side commentary here as we're coming down now near the end of our time, is about making a good first impression. And so when reaching out to families, you know, we all have experiences, you know, kind of in our lives when someone's contacting us, or we're going to a store, or, you know, in any kind of way, we're meeting someone new. Kind of what's the first impression like? What do they seem like? What's you know, how do they present themselves? So some of these tips really are related to trying to help people make a good first impression. And now, just to let Morgan know, I think if we start bringing up the polling questions now, we just have a couple slides left. I know it takes a little bit of time to bring those back up. We'd like to do that. But really, family involvement is all about, you know, help people think through what options are the best match. And then involve the family in that way. So that may also mean, as a program, as teams, thinking through which mix of family involvement options are you going to provide, and how are you going to provide them. And you know, a good starting point, again, is to look at HCBS services and take a look at what's offered there, and think through, you know, maybe what you're best positioned to think through and begin offering. You can look at these slides at some of the options that I talked about earlier. So there's kind of a number of things that you can do, but really, you know, to help people think through what is that best match. Once the polls are up on the right, we'll invite you to answer those questions before we wrap. Just a couple other additional key issues. We just want to acknowledge that that implementation of family work can be difficult for practitioners and programs, not always, but it can be depending on people's backgrounds. And also just to acknowledge that many practitioners have mixed feelings about family involvement for just a whole variety of reasons, whether it's family blaming theories and kind of some of the older kind of theories that families were to blame. So, you know, working with them may not seem logical to some people. Maybe that, you know, in the field, we've seen families kind of at their worst because we tend to have contact with families when their relative is in some kind of a crisis, in which, you know, you're set up to see people kind of functioning at their worst. Some practitioners then have anxiety about involving families and what to expect and how's it going to go, or there's a lack of training. So, you know, there's a lot of key issues that, just to be realistic, that we wanted to acknowledge, but we also want to acknowledge that kind of really the jury's in, the verdict's clear, that there are many benefits if practitioners kind of do it right, give people choices, respectfully offer people things, and, you know, in a range of family involving services. That brings us back now full circle to the take-home messages, which is that families and significant others are important and can be helpful members of the team. Hopefully you've gotten that. And with proper documentation, involving families can be a strategy to provide optimal care that's needed and cost-effective. So kind of all this work, the engagement, the pre-planning, outreach with families, the work that you're doing, the specific intervention option, really all, again, needs to be kind of documented very, very clearly. So that brings us to the end of our time. I want to thank you so much for being here and being a part of this meeting. This was the final utilization series event. We do want to let you know that we'll be emailing a link to a very brief, it's really brief evaluation of the entire series. And so we'll ask you to consider taking just a few moments to complete that, really to help us ensure that future managed care TAC offerings are going to be helpful to you. And if you have any questions or anything that you want to know more about, or please email any questions, comments, or suggestions to the following. You can see the email listed there, and go ahead and put, if you would please, in the subject line, Family Engagement Webinar, so that we know to what you're referring. And again, if you haven't already, before you go, please take a moment to complete the survey in the comments section to the right. And thank you again very much for your time. I really appreciate it, and have a good rest of your day.